Hello, this is Anne DeGheest, and it's November 27, 2021. And like in the movie The Godfather, I thought I could ease out from doing this COVID update, but unfortunately the virus has come back with two surprises and is bringing me straight back in. One is a new variant called Omicron. We do a deep dive on that. And the other one is a fifth wave that started in Europe and may be coming into the US. So let's go take a look. So on the good news side, we have a booster from the mRNA has shown a 25 times increase in your antibody, the neutralizing antibodies. And we may need that with the Omicron. 70% of Americans have at least one vaccine dose. Pfizer, Moderna, and J&J have not been approved for their booster. Pfizer has a new pill that may be effective as soon as you get infected and decrease by 89% your chance to get hospitalized or have a severe case. And the CDC data, you don't want to miss this at the end of this presentation, show the data on vaccine effectiveness for children and the booster data. On the unfortunately, the bad news, Europe is clearly starting a fifth wave and is absolutely exploding there, driving new restrictions. US is typically 4 to 6 weeks behind and is starting to show increase in the Midwest and Northeast. We had disappointing data from Merck on the oral pill effectiveness. And unvaccinated survivors have a 5.9 higher risk of hospitalization without vaccination. So because you have been infected doesn't mean you have the same protection as somebody who's vaccinated against severe case. The ugly, we're going to do a deep dive on Omicron, and the new variant has emerged from the South African countries. Unvaccinated people have a 15 times higher risk of being infected, and that's where the hospitals are now full of unvaccinated people. And unfortunately, the 2021 COVID death rate now is higher than 2020. So I need your help. Please support these channels. Give me a thumbs up if you like the content, and subscribe and post to your network as YouTube has changed their algorithm. I need your help. Also, if you haven't seen my October video, it does a deep dive in the COVID boosters and which one may be the right one for you. So let's look at the famous Omicron. What do we know? It comes from 8 South African countries, probably came from HIV patients there where the virus was able to mutate because it stays in the patient for a long period of time. It's clearly the first case, I think, came from Botswana. The World Health Organization is showing this as an example about why vaccine inequity will enable the virus to mutate in countries that have low vaccination rate. And we have to deal with access to the vaccine as well as dealing with vaccine hesitancy. The first case was in Botswana, but it's perceived to be now having spread in Europe. We'll spend a bit more time on that, but the equivalent of the CDC in Europe is saying the likelihood that Omicron will spread across Europe as high. That variant has 50 mutations, 32 in the spike protein areas. This is the most divergent we have ever seen of any variant. And we're going to look at these mutations. Over 100 cases have been reported. Remember, these are cases where we did the genomics of the virus and have been identified now in Belgium, the UK, Hong Kong, Netherlands, Israel, Germany, and Italy, and I'm sure more to come in the coming week. The good news is Omicron is detectable by PCR. And it basically, if you know at PCR, there are 3 channels. It turns out Omicron lightens up only 2 of the channels, so it has its own signature, which will mean that we should be able to identify that variant very quickly there instead of doing the full genomics. So South Africa has seen a drastic rise in positivity rate in a matter of a couple of weeks due to this variant. To give you an idea, it's estimated it's 5 times faster in spreading than Delta, which is stunning. So Delta, if you remember, was 70% more transmissible than the original Wuhan virus. And it's perceived by 2 sources that Omicron is 500 times more transmissible than the Wuhan virus there. And that's really worrisome there because we know that the Delta variant took over the world in a matter of 3 months. So what else do we know about Omicron? We don't know if it increased transmissibility. Of course, you're going to see some data that shows that we're high risk. That's the case. We don't know if it's escaping our vaccine antibody or people who have had infection-induced immunity. Although we're suspicious it could. And we don't know at all if it's increased severity in hospitalization or death. When will we know? Probably in a few weeks, and that's going to come from two sources, the lab studies, and the vaccine companies have already started testing the antibody response to this Omicron. And remember, the number of mutations does not mean it's going to be more severe. And the real-world evidence, which will require more genomic testing and case tracing. The good news is that we got it really, really early. South Africa has an amazing genomic detection program, so they were able to alert the world as soon as they start seeing it in a matter of a couple of weeks. And the mRNA vaccine can be quickly altered, and we could get a new vaccine if needed, underline if needed, in a matter of maybe 6 to 9 weeks. So let's look at the mutations there. This is the list on the right side. In red are the bad ones. These are mutations there that we know from the past, like none of them have been seen in prior variants of concern, like the Delta and the Alpha. And we also, in purple, are the mutation not seen before, but we have lab data because we have speculated what mutation could be, so we know if they're a threat. In yellow are people that we don't have enough data, as well as the blue. The light blue here are the ones we have never seen before. That's a long list that we need to collect data on. And in green, there's only one, is the famous D614G, which is in pretty much most of the mutants, and it started, if you remember, with a California mutation at the beginning of 2020. So what do we suspect on the impact of this mutation there? There are several parts of it that seems to enable resistance to neutralizing antibody, not only for the vaccine, but also the therapeutic monoclonal antibodies. There are also other clusters of mutation that historically have been associated with a more efficient cell entry, i.e. it takes less viral load to enter your body, therefore it's increased the transmissibility from person to person there. We know there's other mutation there that can allow you to evade your innate immunity, which means it takes a while for immunity to kick in, and by that time you have an explosion of the virus inside your body there, so therefore you increase transmissibility. And so it does look, based on what we've seen so far, that there's a very high risk for increased transmissibility and infection rate. Right now, reality check, the dominant variant is still the Delta. You see this in green and the light blue. And here's the little red dot here. That's the Omicron. So it's just happened. So a quick question we don't know yet is that with the Alpha and the Delta, it took over the world in a matter of 3 months. So two things will happen. Delta is so contagious and established that the Omicron cannot get a foothold and cannot spread, or it takes over the world the same way that Delta and Alpha. That's the big question in the coming months or two. What do we know from travel data? The first is in Hong Kong. Was a 36-year-old that was fully vaccinated. He had 2 Pfizer doses in May and June. He was a male. He was traveling through South Africa for a period of a few weeks, so he did get exposed. And before returning to Hong Kong, he tested negative on the PCR. In Hong Kong, there's a normal process of being quarantined and having testing. On day 4 of the quarantine, he tested positive on the PCR. He somehow seems to have infected the person across the hallway, so it is very infectious and going through the air. That person was also vaccinated with Pfizer recently. And when they measured the load on the swab, it was a very high viral load, which means it's highly contagious. Amsterdam just reported 2 flights from South Africa with 624 passengers, and 61, so roughly 10%, tested positive. And that's stunning because all the passengers were ever tested negative or shown proof of vaccination before getting on the plane. And it is expected that many of these positive cases where people were vaccinated. Right now, they're being observed and isolated. So, new travel restrictions are coming in place. Israel is banning the entry of all foreigners into the country and is reintroducing phone tracking technology. The UK is going to require PCR tests by the end of the 2nd day after arrival into the UK and requiring people to self-isolate until they have a negative result. if you have been exposed, you may have to self-isolate for 10 days, and they're going to put more restriction on masks. Australia is, for example, banning non-citizens who have been in the 9 southern African country, and the US is also banning those travelings from South Africa. In addition to all of this, Europe is battling a 5th wave, and this is a stunning wave. Look at the rate of acceleration on the right side there. It's higher rate per million than what we saw during the peak of the winter surge. And it's pretty much across Europe. You know, Austria and Belgium and the Netherlands are the worst right now, which is why you see the biggest restriction. Germany and the UK are having some issue, as well as France. So as a result of that, we are back into lockdown. Austria is a 3 weeks lockdown that just started. France is requiring a booster for people over the age of 65 to qualify for a digital vaccination certificate. The cluster is really centered around Austria, Hungary, and Slovakia that have low vaccination rate. Netherlands is putting new restrictions in place. Belgium is forcing people to work from home 4 days per week. And there's even a night curfew on the Italian border. So, unfortunately, that led to violent demonstrations, including activity by the police in Brussels, Vienna, and Amsterdam. People are talking about regional lockdown and restriction on unvaccinated people. So lots of things happening in Europe that may be precursors to what's happening in the US. US is going back up. This data is a little bit misleading there because most states don't report data for Thanksgiving or the day after Thanksgiving. So you need to really look at the trajectory before Thanksgiving. We were averaging around 95 to 100,000 cases over a 7-day average. And as high as 150,000 cases several days ago. So it's clearly on the way back up. Now, the good news is the vaccination rate is not 70% for all age of at least 1 dose, but still 59% fully vaccinated. And that is not protecting us if Omicron comes here. We have a 5th wave that is clearly coming. Biggest hit is Michigan, and Michigan has 10% of the US cases right now. New Hampshire is also being hit pretty hard there, and New Mexico. So basically, it's the Midwest and Northeast. And you can see this if we break this down by regional waves. Now, that's probably because the weather is the coldest there first, and it's probably going to hit us in the west and the south as the temperatures start dropping and people stay more indoors. So, as you would expect, Michigan, Minnesota have the high rate, and of course, it's leading to a high hospitalization rate. You can see Michigan and New Hampshire are basically going back up with a 4 to 6 weeks delay between the beginning of a hospitalization and the new cases going up. Unfortunately, the US now has had more deaths in 2021 than in 2020. We have a total of 777,000 people, unfortunately, have died in the US. And that, of course, the Delta variant has been a big driver of this. And that's because of the lower than expected vaccination rate. Part of the problem is a communication by public health officials that did not really fully explain that the vaccine doesn't stop the virus to infect your body, and you can still, be infected and spread it out. It just protects against severe cases. And so it's been a lot of confusion about the effectiveness of the shot in preventing infection versus severity. We also have done a terrible job at testing to prevent super spreading events. So on the good news, there is 2 drugs going through the FDA right now with good data on what could be used within 3 to 5 days after you have been infected, a little bit like Tamiflu has done for the flu. Let's look at the first one. Pfizer has shown an 89% effectiveness against severe hospitalization. And that's if you take the pill within 3 days of diagnosis. The way that works is that the virus enters your body and breaks down its RNA that escapes into the body there and creates what's called a polypeptide. And the polypeptide job is to start basically making new virus. And in order to do that, it needs an enzyme called a protease to make the cut to assemble the virus and explode the virus inside your body. And what these drugs are doing, they're inhibiting this enzyme to effectively break these assemblies to make new virus. And that's how it has to be done in a short period of time after you've been infected, because if you remember my prior video, you have that explosions of the virus between day 5 and 10 of the exposure to a person that's infected. Merck, unfortunately, had disappointing data. They initially had reported 50% efficacy in reducing the risk of severe cases and mortality in hospitalized patients there. Now, the latest data of the full trial show only a relative risk reduction of 30%. In other words, if the mortality risk for hospitalized patients was 9.7% in the control group, it dropped to 6.8%. Still an improvement, but not as high as what you saw from the Pfizer data. Fluvoxamine, which is a drug that's been authorized for depression, seems to be effective in stopping the cytokine storm that creates all the severity in hospitalized patients there. And this is what's called a selective serotonin reuptake inhibitor, and it seems to decrease the severity risk by 30%. What's great about fluvoxamine is the cost of therapy is $4 for a treatment around 10 days. So it's really something that should be made available to everybody. Just a quick reminder of the drugs approved by the FDA under emergency use authorization. There's dexamethasone, which is a steroid, which basically stops the cytokine storm or decrease it. Remdesivir, which is an antiviral treatment there for Ebola. These are very expensive drugs to be used by hospitalized patients only. And the treatment in non-hospitalized is monoclonal antibody. The concern there is monoclonal antibody are very narrow in the spectrum there, and there's a perception that this new Omicron may be able to escape the monoclonal antibody, to be seen in the coming weeks. Breakthrough cases are as infectious as unvaccinated. So what the data from the Lancet seems to show that the peak viral load from somebody who has a breakthrough infection is the same level than an unvaccinated case. So if you do get infected, you can spread the virus as well as an unvaccinated person. And that's an issue there because what's called secondary attack rate, which is who gets infected from the original infected person, the majority of them are in a household. And unfortunately, that means that if you're fully vaccinated, you have kids who are unvaccinated who go in and out of school there, you may still, get infected and pass the virus. Good news, if you have worry about long COVID and getting a breakthrough case after being vaccinated, it's been calculated that it's a 0.7% risk after you have had the vaccine for 6 months. And that's made out of a very large data set of 16,000 breakthrough cases out of 3.5 million cases. So you're still at risk, but it's a much lower risk if you get vaccinated. And that's critical because neurological impact have been confirmed after 7 months that 24% of people who have been infected, and that include asymptomatic and low and mild cases, have cognitive problems, and that's affecting the memory and coding and recall. And the reason is that they have shown that SARS-CoV-2 can damage the small vessels in the brain. It goes through the blood-brain barrier and damages the small vessels, and that creates all these lesions that creates the memory problems of the brain fog. Another data from the CDC showed that on the average, you decrease by 50% your risk of long COVID after vaccination. So if you had any doubt and if you have any concern about long COVID, please get vaccinated. Let's look about vaccines. So pretty much vaccine have been approved for age 18 and up for the booster. And the only vaccine for children is the Pfizer one right now between 5 to 17 years old. This is amazing data. It shows that you can increase by a factor of 25-fold, so 25x, the amount of neutralizing antibody that you have. And that's the data that just came out, and it shows that the IgG, which is neutralizing antibody there, can drastically increase, and on the average, it's around 25 times. Some people are significantly higher than that. So please, please, please get your booster. The other good news is that you get that effect 6 to 10 days, not the full 14 days that we had after the second dose. Data from AstraZeneca showed that the effectiveness of AstraZeneca with a booster go from 44% to 93%. So you really need to get a third shot if you have AstraZeneca, and confirm the data we've seen for Pfizer that it goes from 62 to 92 to 94%. And that's because you really need to be protected from children who may still be carrying the virus. This is a study that came out of China that showed that 2 children basically was responsible for an outbreak of 246 people. The children are the red square, and you can see how it spread through the household and the community in a short period of time. And 31% of the children were unvaccinated, and that's how the spread happened. And that ties us to some of the data we're going to see from the CDC. The CDC just came out that people with natural immunities, i.e. they got infected and have antibodies, are still at significantly higher risk, over 5x, of having a second infection and being hospitalized. And so that's a very big delta. And it looks at Moderna, if you get vaccinated, provides a slightly better protection for reinfection rate than the Pfizer for people who have had an initial infection. U.S. children cases are up. It's been as high as 10%. This is a dark blue line at the bottom here. And they have shown that 38% of the children in the U.S. between the age of 5 to 11 have already been infected. And that's by looking at antibodies and looking at the seroprevalence. So pretty much the school reopening there has spread the virus, and 38% have been exposed already. And the reason why the vaccines are effective, this is a data again from the CDC. If you look at the mortality rate before a vaccine was available there, COVID-19 is the more fatal one for children compared to varicella, rubella, and some of these other viruses that we've seen in the past. So CDC is recommending that children should get vaccinated because the benefit, including a multi-system inflammatory syndrome, which is typical to children, really outweigh the benefits, outweigh the risk. And we're going to spend a bit of time on the potential risk. So again, highly recommendation that all children, even the people who have been seropositive, should get a vaccination. So the limitation of the antibody testing, don't assume that you test your child to see if they have antibody, because pretty much the data is unreliable. It's called the sensitivity, especially after 3 months of infection there. So the FDA does not recommend any test that will allow you to determine if you're protected from infection. So more data from the CDC. It shows the data on the booster. So a reminder, Pfizer is the same dose, 30 micrograms for the booster. Moderna is half, so it's 50 micrograms instead of 100, and it's half the dose, 0.25 microliters, which was confusing to me when I got my booster, so I give you the heads up. And then Janssen is the same dose, and that's after 2 months, where the other one is after 6 months. Unvaccinated have a 15 times higher risk of being hospitalized. And that is being confirmed by the amount of people in the hospitals that were unvaccinated. It's really the high risk. Please help people get vaccinated. Data that was submitted by the CDC showed the decrease that Delta did on the protection against infection. This is the blue line, especially for people over the age of 65. And in the red line is the hospitalization. You can see that the hospitalization protection had dropped for Pfizer to the mid-70s. And that's why they started recommending the boosters. The good news is that you still had a pretty good protection compared to Pfizer, to J&J, which had dropped to the low 70s, maybe high 60s. Serious side effects. We're going to be talking about which one is the right booster or vaccine for you. So people who are between 18 to 24-year-old males have to be concerned about Moderna, and I think Pfizer has some issue there, for myocarditis, which is an infection of the heart. Typically, the symptoms will appear in the first 7 days post the second dose, and that's around 39 cases per million. So it is still very rare. With J&J or the Janssen vaccine, you have to worry about thrombosis, which is blood clot, which is more targeted to female. That's why a lot of them are not recommended in Europe. This is between 30 to 39 years old, and that can last 3 weeks. And that's 10 cases per million. And the Guillain-Barré syndrome, which is a neurological problem there, is old male, between 50 to 64 years old, and that's at 16 cases. So that's the J&J concern. So again, a quick reminder there, the mRNA, the worry is for male age 12 to 30, that you need to keep an eye on them. So unfortunately, we have some sad news. There has been over 100,000 drug overdose deaths in the last 12 months in the US, and the majority are coming for the young population between 20 to 35 years old. So if you know anybody that is depressed and is showing symptoms he needs help, please help them and intervene to make sure we don't have a sad ending. There's a massive US healthcare exodus. 30% have quit or have been laid off, and there's another 31% who would consider leaving. There's a massive burnout of the healthcare workers who are willing to work really hard in 2020 when there was no vaccine and no therapy, but now getting very frustrated to be threatened and insulted by the anti-vaxxers despite the fact that they're totally burned out with very long shifts. So please support them and help them in any ways. So I need your help. Please support these channels. Give me a thumbs up. Subscribe and post to your network. If you haven't seen my video of October, there's two of them. One is what's the best booster for you, and then the other one is on long COVID. So please stay healthy. Please continue to take precaution with the Omicron coming. We continuously need to be vigilant, even if you're vaccinated. Use common sense while traveling, and continue to wear a mask if you are into a higher density exposure area. Stay safe, and hopefully I don't see you in a month, but I'm suspicious I will have to provide another update. Stay safe.